Hello, my name is Bailey, and today we'll be presenting on Imogene King. All right, let's get started. Okay, so Imogene King developed the goal attainment theory. She was born in West Point, Iowa in 1923. She graduated from St. John's Hospital School of Nursing with her diploma in 1945, and then graduated with her BSN in 1948. Imogene then went on to obtain her master's in 1957 and eventually received her doctorate in 1961. Imogene was a professor at many different institutes and published many works throughout her career. She did end up expiring in 2007. All right, so a little bit about me is that I've been a nurse for roughly 5.5 years. I've spent time in many different fields, and a common theme I've found is the care plan. I have found Imogene King's theory laced throughout my time as a nurse in all areas of nursing. Mutual goal setting is important down to the smallest of tasks. Although I've spent my time as a nurse in different fields, I continue to be drawn to pediatrics. I'm currently in the pediatric nurse practitioner track and look forward to continue setting goals as a provider in the future. I chose this specific theorist because her theory describes an interpersonal relationship that allows a person to grow and achieve life goals. It is why I wanted to become a nurse in the first place. And you can see me. I'm right here. And this was at Christmas time at Children's Mercy Hospital in Kansas City. Okay, so this slide will be giving an overview of Imogene's theory, goal attainment. The basic concept of the theory is that the nurse and patient communicate information, set goals together, and then take actions to achieve those goals. The nurse creates a care plan. This encompasses an assessment made by the nurse and a medical diagnosis. Once this is done, then the nurse can set mutually agreed upon goals with the patient and set interventions to work towards those goals. Finally, the nurse assesses to see if the outcomes were achieved. The care plan would then be updated to better accommodate the patient. This is a never-ending cycle where the patient and nurse are constantly working to move in a forward direction towards healing. So as you can see, mutual goal setting, or interactions, mutual goal setting, interventions, and outcomes. All right, so this slide talks about the main beliefs Imogene King had. I like this slide a lot because it shows how much of an impact Imogene has had on the nursing profession. I feel like these values were taught in nursing school and are embedded in how the nursing profession carries themselves. She believed patients want to actively participate in their care. She believed interactions between the nurse and patient are based off of perceptions, needs, and goals between both parties. All patients should be respected as human beings of equal worth who have their own set of values. It is the responsibility of the nurse to inform individuals of options so they can make informed decisions. Patients have the right to accept or reject aspects of care. Patients are in a continuous transaction with their internal and external environment. All right, so moving on to concepts. Imogene King had three main concepts weaved through her theory. They are personal system, interpersonal system, and social systems. The personal system includes perception of self, body image, time, space, and growth and development. The interpersonal system is more of human interaction, communication and coping, and transactions. Lastly, the social system includes organization, power, authority, status, goal attainment, and decision making. She believed all of these systems were needed for the goal to be met. Okay, this is a picture of my infographic, and It goes into detail about the specific concept interactions. Okay, so for contributions to healthcare, Imogene King published many works, including books and numerous articles. Her most notable works are her books she published. Her first book is called Toward a Theory for Nursing, General Concepts of Human Behavior. This book was published in 1971. Her next book, published in 1981, was called A Theory for Nursing, System, Concepts, and Process. And her last notable book was Curriculum and Instruction in Nursing, Concepts and Process. This last book was published in 1986. Okay, when it comes to her contributions to nursing, she set up how we interact with patients. She implemented the nursing care plan by way of having a conversation or interaction with a patient and developing a mutually agreed upon goal. This process is an ever-evolving assessment, diagnosis, intervention, and evaluation. This plan is constantly evaluated and then changed while interacting with the patient. She takes it a step further and involves beneficence by incorporating moral and ethical reasoning, whereby the nurse uses a knowledge base to help the patient maintain or regain their patient's health. She also developed the goal-oriented nursing record. This was a method that could be audited in the future, what we now know as the nursing care plan. The 5 components of the GONR includes the database, problem list, goal list, plan, and progress note. Okay, so for theory, practice, application, Imogene's theory can be applied to most clinical settings, such as a patient with renal disease, providing care for critically ill infants, providing care for women with hospitalized preterm infants, an elderly patient with cerebral vascular accident, providing psychiatric care, developing alcohol use dependency care for adult females, caring for comatose patients, and caring for adults with diabetes. I found it interesting that her theory can also be applied to advanced directives. Goodwin, Keel, and Peterson came up with the Patient Self-Determination Act based off of King's theory. The model guides interactions between clinician and patient regarding end-of-life issues. So the patient makes their wishes known during crisis. They legally state their goals prior to needing them. This is a legal means to accept or reject care. The theory is also best in evaluating the active, autonomous, collaborative, and individual relationships between the nurses and clients. Okay, so I thought the best way to apply theory to practice would be to give an example. So my example is a 6-month-old child having viral cold symptoms. So for a pediatric nurse, I would assess the child. So she's a 6-month-old female with a high respiratory rate, retracting, she has some congestion, and then she had exposure to a viral illness at daycare. Next, I would diagnose. So I would run a test for RSV. I would get that test back, and it would either be negative or positive. In this case, it's positive, which confirms that the patient does have RSV. Next, I would intervene. So in this case, the patient's going to be admitted to the PICU for high flow nasal cannula, suctioning, and then fluids. And last, I would evaluate. And in this case, the patient is no longer retracting. The respiratory rate is within normal limits. And then we would go ahead and make another intervention, lower the settings on the high flow, and we would continue to monitor. On a smaller scale, using the same scenario of RSV, we would assess the patient has a high respiratory rate. The patient then, for a diagnosis, is in respiratory distress. Intervention, we would place the child on high flow nasal cannula and alert the attending. And evaluation, has the breathing improved? If not, We could adjust the settings to higher or lower based on what we are, assessing. And that would just kind of continue until the patient got better. Okay, so when applying the theory from a nurse practitioner perspective, I would give a personalized plan of care. I would allow longer clinic visits for complex patients. For patients who speak a different language, I would provide an interpreter. People learn in all different ways, so I would thoroughly explain the instructions, but then give them a handout of what we discussed as well in their language. That's always important to note. It obviously wouldn't help if I gave them an English handout when they speak Spanish. So I would also speak to them about the portal, or make sure that they knew our phone number or any other ways to contact us if they had further questions once they got home, or if anything were to pop up, they could always know how to reach us if they had any further questions. I would make sure the patient was told by me personally when their follow-up visit was, and also have it written on their handout. I think that's important instead of just placing that on the front staff. The patient actually having that from the provider, knowing when their follow-up visit is, makes them remember it a little bit better. And then before proceeding with any exam, I would make sure I heard the client's concerns and questions first. Once I did the exam, I would speak to the client and try to set a mutual goal and appropriate interventions, and then follow through with those. Okay, and lastly, for the critique, the main assumptions that influence King's theory are the individual has the right to obtain information, participate in decisions that influence their life and health, and to accept or reject care. She wholeheartedly believed in maintaining the autonomy of the patient and believed the nurse should help in this. Patients should be respected and have the right to voice their opinion. It is through the interactions that the nurse finds out the patient's true wishes and can voice it to the rest of the healthcare team. This is how nurses become the strongest patient's advocate. King's theory could use research in the aspect of group settings, utilizing transactions with groups of individuals who had different goals is not addressed. The theory also doesn't give explicit guidelines for assessment, diagnosis, or intervention. One last thing that could be further explored is patient satisfaction. The concepts not defined are satisfaction and effective nursing care. This is important to deem if the outcome is appropriately met. Plummer and Molzan explored quality of life later in 2009. Now, on the other hand, Imogene's theory is a grand theory, and therefore many theorists have been able to develop theories off of her theory alone. King's theory is an excellent foundation in providing perceptions, communications, and interactions when making nursing judgments. She has shaped how the nursing profession interacts with patients. King's theory is one that has been around for many years and will continue to be embedded in future nursing practice. All right, and here's my references.